Hi, everyone. I'm Liz Swanson with ICAHN, and welcome to the informational meeting today about expanding a resilient rural healthcare workforce. I'm excited to share with you the opportunities that are going to be available through the Rural Healthcare Transformation Grant Program, and just excited to share with you what's out there and what's available and how those grant funds can help your hospital. So with that, we'll go ahead and get started. There's also going to be opportunities for you at the end to unmute yourself and ask questions. And if you do want to send in the chat, that's fine. I can't see the chat as it comes in, but we can address that at the end of the presentation. So we'll go ahead and get started. And first of all, with the program overview with workforce development, the purpose of the workforce development money with the Rural Healthcare Transformation Program is to expand and strengthen rural healthcare workforce, to support sustainable workforce solutions for rural hospitals, and also to improve high quality healthcare across rural communities, which we all know is very important. ICANN's role is to identify as a subrecipient to administer workforce funding. So we will be administering that funding to the hospitals for you to use. Provide resources and guidance to participating rural hospitals. We're here as a resource to provide technical resources through the process, and then empower hospitals to determine their own workforce priorities. And we have felt like this is a key to this is that we want you to decide what your workforce priorities are. You know your hospital, you know your workforce shortages. We do not want to determine that for you. We have felt strongly through this whole process that you needed to be able to decide what your workforce shortages and your workforce priorities were. So the program goals: transforming rural healthcare, developing value-based care models for regional healthcare partnerships. This is for rural healthcare transformation overall in hospitals and primary care practice spaces, overcoming geographic barriers to care, improving access to service through investments in mobile health, mobile crisis, and EMS services by expanding telehealth and technology innovations, and then building that resilient workforce. That's a key part of rural healthcare transformation. And as part of that, there's scholarship recruitment and retention funding, university program expansion, and regional training. And these are really the three things that Illinois aims to target with the rural healthcare transformation money that's coming to the state of Illinois. So ICANN is actually in charge of three different areas or three different projects with the Rural Healthcare Transformation Funds, one being the workforce program that you're going to learn a little bit more about this afternoon. But we also are doing the disease prevention and the technology transformation. So Kathy Hull is going to share just a little tidbit about the disease. I can't even say that. I stumble over it. Disease prevention grant. And I'm going to let Kathy share just a little tidbit if she would.
Absolutely. Thank you, Liz. And good afternoon, everyone. Looking forward to, as Liz said, just seeing these grants get in your hands and seeing what you can do with them. And I want you to think of the three grants. The more I've thought about it, the more I feel that they're so very connected. The disease prevention grant is a little bit more clinical. The technology grant, of course, is a little more IT focused, and then the workforce grant being the people focused. But I think it's all one big goal that we're trying to achieve, and that is really improving not only the access to care, but the overall health in our communities. And disease prevention is just as it sounds. You are going to select some sort of a disease state or a state of wellness or illness that is part of your health needs assessment, and focus in on that and really thinking about how can we improve, let's just say diabetes or mental health, or pick one, whatever is in your area. And another thing that I think Liz pointed out that's really important is this is yours. This is not something that's the state has chosen for you or ICAHN has chosen for you. This is really all dependent about your community and what is pertinent for your population. And if you'd like to know more about the disease prevention, tomorrow at 9 a.m. we'll be talking specifically about that. So look forward to talking to you then, and I'll turn it back to you, Liz.
Sure. And I'm going to actually ask Brian Ashpool to share a little bit about the other part that we're managing at ICANN is technology transformation. So, Brian?
Yeah, thanks, Liz. Good afternoon, everyone. Just to touch briefly on some of what we're planning with the Technology Innovation Initiative. We will have more information to share soon. Been a little delayed compared to the disease prevention and workforce development initiatives. But we'll be scheduling education sessions, much like the one we're having today, here in the near future. I would imagine within the next couple weeks. So one thing we are looking to do as kind of a first step in that technology innovations initiative is to solicit proposals from vendors to then conduct a digital readiness and needs assessment with all participant hospitals to gather some baseline data, which will then ideally help inform hospitals where the technology innovation funds may be most beneficial for technology projects that you will eventually be applying for. We are also going to be working to identify a vendor that will be doing assessments related to cybersecurity, and a vendor, maybe the same vendor or a different vendor that will then be helping to implement cybersecurity tools and solutions for those hospitals that may need those. So we'll have more information on those, the Technology Innovations Initiative very soon. So be on the lookout for that. I'll turn it back over to Liz. Thank you.
Thank you, Brian. I appreciate that. And thank you, Kathy, for sharing also. So we'll get into now the more specifics of looking just a little bit to share the funding timeline, and then we're going to get more specifics into what workforce development projects would look like. So just so that you know, just the basics, this is a 5-year project, a 5-year program, and each year will have its own funding grants that you can apply for specifically. Now, hopefully, with grants, things can change, but the way that it's set out now, the funding is set to go through September of 3031, or September 30th of 31. So it actually started on December of 2025. We've been in the prep phase of getting everything going, and now we are in the phase of actually getting the grants out, getting the training and the applications out, and then our goal is to have those applications ready for you guys to be able to submit in September. And then if everything goes well, fingers crossed, have that money available and start going out to the hospitals in October. But that's all very hopeful right now. So with that, with the workforce funding vision, it's local solutions for a sustainable workforce. And the exciting thing is that ICANN has $5 million to go out for this first year of funding to hospitals around workforce. And that money will have to be spent by September of next year. So that's a nice chunk of change to be spent in our hospitals. and in rural hospitals in Illinois, not just ICAHN hospitals, but the small and rural hospitals in Illinois around workforce development efforts in the next year. So that's very exciting. And I'm excited to see what kinds of things can happen. So the way that that works is that we have really broken this down into 3 different efforts that we are going to see funding spent in. And it's going to be around recruitment, educational awards, or like scholarships, and then retention efforts. And the guiding principles around this are they are hospital driven and planned. These projects are flexible implementation, that you have long-term sustainability with whatever projects that you're trying to put together. We do not want these to just be short-term, just for the money, for the 1 year. We want thought to go into them so that whatever project you're putting together has some sustainability. And then regional collaboration where appropriate. If there are ways that you can collaborate with other hospitals or other organizations within your area, that would be great. It's not required, but where appropriate, that would be perfect. So the first funding we're going to talk about is that recruitment funding. And this is it's kind of a bigger pool of money. And this would be recruitment funding supports innovative and sustainable workforce strategies. And this is to recruit clinical professionals, recruit allied health professionals, develop apprenticeship programs. We've seen some hospitals that have really had some great nursing apprenticeship programs that have started, but those are programs that are a little bit more costly. So this would be something that would require a little bit more funding than necessarily like an educational award. Um, Maybe a visiting specialist would be something, or expanding training opportunities, develop regional workforce models in some situations. Maybe there's a specialist that could be shared by 2 or 3 facilities. You couldn't afford to pay for just one, or wouldn't have the work for that individual to do at just one hospital. But if 2 or 3 hospitals went together, it would work. Increase specialty care access. That's what this recruitment funding is designed to do. So that's the one bucket of money, is really designed around recruitment. And as I said earlier, it does not have to be, when we first started talking about this, there was a very limited pool of healthcare professionals that were on the list. But it was decided very quickly that each hospital was unique, and you know what healthcare shortages you have. And it may be a podiatrist in one hospital and a nurse in another, and a respiratory therapist in another hospital. So it just depends on what your workforce shortage is. It improves access to care through the recruitment funding, reduces patient wait times, better care coordination, expanding primary care services, and increased specialty care services by being able to provide this. So then the educational award funding is really around providing help for individuals who want to either change careers, advance their careers, or high school seniors that want to take on healthcare as their career choice and stay locally or stay rural. So it gives you a chance to provide money for that person who is an LPN who wants to be an RN, or somebody who wants to, that has never gone to college but would really like to, suddenly wants to be a healthcare professional, or that high school senior who is really pursuing that. So this is really kind of about growing your own workforce. And there is a work back commitment, and we'll talk a little bit about that later. But with the educational award, the money can also be used for not only tuition, but childcare support, transportation assistance, educational incentives, and and even other scholarships. So the recipients enter into employment service agreements to the hospital to strengthen long-term workforce stability. And we're going to talk more extensively about that 5-year work back commitment on another slide. So really that creating sustainable workforce pipelines, it's developing your local talent, reduces workforce shortages, increases employment advantage, and builds long-term workforce capacity. It gives you a stronger local workforce, greater employee loyalty, increased community investment, and it's sustainable recruitment pipeline. So then we get into retention funding. And I think this is really a great opportunity and kind of a unique opportunity because there's funding out there for, a lot of hospitals are already doing educational awards or scholarships. But when we were putting together this program, we also felt like there's a lot of employees and loyal employees that have been around a long time that there isn't necessarily retention funding or a lot of efforts put into keeping them happy or supporting them. And it was really interesting. We just had a nursing leadership training, and this whole topic around retention and workforce retention came up on that webinar, totally separate of this issue, but it is a real issue in your hospitals that I think your employees are probably feeling. But this is an opportunity to really give your long-term employees some programs and some incentives that haven't been there before, some retention bonuses, possibly some loyalty bonuses, to build some career ladder programs. One of the things that was mentioned on the call today was paid preceptor programs, how they would really like that in the nursing arena, mentorship programs, leadership programs, expand your onboarding efforts, professional development efforts, innovative compensation models. All of those things can be looked at and creatively looked at through retention funding and requested through this grant. So, investing in workforce stability, retention strategies are designed to improve employee satisfaction, increase engagement, reduce turnover, strengthen your workforce continuity, support knowledge transfer, and develop future leaders. So we have put together a tiered funding approach, and I will say that it's probably not a perfect tier because we're not sure how many people are going to apply and how the numbers are all going to shake out. But the way that we're looking at it now is that if you are seeking educational award funding expansion, whether you are looking at starting an educational award program or doing something to really expand the educational awards you're already offering, the funding will be in the $10,000 to $30,000 range. In the tier 2, if you're looking at coming up with a retention program for your hospital, it will be in the $40,000 to $80,000 range. And then recruitment programs, because those are going to be heftier. If you're going to start an apprenticeship program or really be recruiting positions to your hospital, then that's going to be in the $100,000 to $200,000 range that you can request for. The numbers that are going to change is the hospital numbers, as far as it depends on the amount that's requested and the amount of hospitals that apply. That will probably change. It could either go up or go down depending on that. But that's what we're looking at now for our tiered funding approach to this. And in those tiers, as you know, we've already kind of talked about and outlined what the education award looks like, and trying to figure out your priorities as far as your greatest shortages, and designing your programs around that. I know one of the questions that is probably going to come up is, can your hospital apply for more than one tier? And at this point, we're saying no. Now, the only exception to that, I would say, is if you are going to combine efforts in like a group, like I had said earlier, maybe there's 3 hospitals that are going to come together and they're going to put in an application to hire one position, and it would be more of a group effort. If your hospital is in like a group application, then you can also put in an application for like a retention project or a educational award project. But you cannot put in like an application for your individual hospital in each of the tiers. We want that to be just one application at this point. That being said, as you are putting together your applications as a committee, or however you are doing this in your hospital as a group, I would suggest that you have kind of a pro a plan B, or a project in the back of your mind. As I said earlier, I'm not sure how this is going to shake out money-wise and how many applications are going to come in. If there is a possibility that once the initial round of funding comes through and we have money left over, I mean, we have to spend the money. So, I mean, there could be a second round of funding. Absolutely no guarantees on that. But if you have a project in mind, it wouldn't hurt to be thinking about that also. But at this point, we really don't want people to put in multiple applications. That just kind of muddies up the works at this point. But every funded project will include, we really want a defined workforce impact goals, service commitment component, long-term sustainability planning, and then alignment with local workforce priorities. And then that whole 5-year rural service commitment. And this kind of can become kind of a bugaboo for some people, I know, but I really think it's something we can work with and make work fairly easily. But with this, CMS is requiring that if an individual receives an award through this grant, and that would be if they receive a scholarship, if they receive child care assistance, if they receive a bonus, if they receive something as an individual that is an award to them, they have to have a 5-year service commitment paperwork saying that they are going to work in not just in rural, but in Illinois as part of this grant. And that is going to be a part of the hospital's paperwork to maintain those records, because you have the relationship with the employees. we will not have the relationship with the people that you are granting the funds with. So there are CMS, we had a meeting with them about a month ago now, and they have told us that there are some creative ways that we can kind of get around that service commitment. They have not gotten back to us on some of those examples, but one thing that you can think about as you're putting your applications together, things that benefit the entirety, like enhancing your preceptor program, um, or your onboarding program, your a leadership training, those types of things would not require any kind of service commitment back. So that may be an option. They've also told us they will get back to us on some other kind of creative workarounds. So once they do, I will share those out with you as you're putting out these applications. But just be kind of thinking about how that 5-year service commitment would work as you're putting together your application. And just, kind of your vision for success is you're going to recruit, develop, retain, and then the results that you want for your project. And it all is about a sustainable, resilient rural healthcare workforce that improves access to quality care for Illinois communities. And we are super excited about what this money can and will do in Illinois. The application and budget I will be sending out to you as an attachment, but at this point, I will tell you the application is going to be in eUNA, which is the online portal that if your hospital applied for the hospital grants through rural healthcare transformation, it's the same online application or same online format. We're going to have a different application. I'm also sending you the application that we're going to be using. You can start in Word filling out those questions because I think it's a good thing to just go ahead and do that. Then you can just cut and paste. Once the eUNA application is open, you'll have that information. It's pretty simple. I mean, I think it's like 8 or 10 questions. It's very basic information. We've really tried to keep this as simple as a process as we can and still get the information that we need from you to move forward with all of this. Same way with the budget. I think you'll find it's a pretty simple Excel spreadsheet. It's not anything really complicated for you to fill out. And if you have any questions with it, we're all here to help. Um, Kathy and Brian and myself are all here to help you kind of walk through the process. And then this is just kind of a reminder. We don't have an exact date of when eUNA will be open, but hopefully, fingers crossed, in September that'll be open. Once it is open, you will have 10 working days to complete it, so approximately 2 weeks. And we will have some technical assistance office hours so that you can call in if you have any questions. And hopefully then that money will be out to you in October and you'll be ready to spend it. So this is my contact information. I will be sending you the slides, the budget template, the application template, and I also will send you a document that explains more thoroughly the 5-year work back commitment from CMS. So at this time, if there are any questions, I will do my best to answer.
Hey, Liz, I do see a couple in the chat here.
Okay.
All right, the first one, Jennifer asks, she said the 5-year commitment is specific to rural Illinois, but not necessarily our specific facility. So
Right.
how will that be tracked if the employee moves to a different rural Illinois facility?
That is something that if they move to another hospital, they will have to, that employee will have to work with that hospital to maintain that paperwork going forward, because it's something that'll have to be reported back on an annual basis, that we'll have to report back to HFS, which is the Illinois um, accounting for that reports into CMS. So we have not worked out all the details of how that's going to work with the 5-year commitment, but there's going to have to be something that new facility would then take on the responsibility of reporting going forward.
Okay. And then Josh asked, does the 5-year commitment pertain to retention bonuses? Just as an example, say a
Does.
hospital gets 80,000 to give retention bonuses and gives each staff member 500. Are they really going to require a 5-year commitment for that small of amount per individual?
Unfortunately, they do. So, I mean,
Okay,
yeah, I know. I know.
that's all right. And then
I wish I could say differently, but
and then
yeah.
just to clarify, when do the funds have to be spent by?
This year of this funding cycle by September of 2027.
Okay. And
So
then
you'll
Jennifer just commented she's had to chase employees in the past to repay those commitment bonuses, and it gets ugly, she said,
I know.
which I believe. Stephen asked, the application will require a 5-year work plan. Can an applicant choose to participate in multiple categories in subsequent years? For instance, an applicant may request funding for recruitment in year 1 and 2, but want to participate in the retention program for years 3 through 5.
Yeah, absolutely. This is just for this year, and each year will be a separate grant application. So you can choose to participate in whatever going forward. You do not have to choose this year for what you're going to ask for in years 2, 3, 4, and 5.
So yeah, I think some of that, Liz, just to clarify, it's just some of those are coming down, those requirements are coming to ICAHN from HFS,
Well, actually from CMS.
from CMS. Yeah.
Yeah, CMS, and honestly, I think they're feeling the heat. As I said, we had our CMS officer came to visit, and I think they're understanding that this is a little more difficult than they originally thought. So I don't know what's gonna happen, but I just got the feeling at that meeting that they were feeling the heat from all over the United States, that the 5-year work back commitment is difficult. So we'll see.
Liz, I want to jump in on the question about chasing the employees, because there needs to be a process at each hospital, and that will be part of the application, and then the grant agreement with ICANN, that the hospital has in place some sort of process to track people that are getting money for educational purposes. That would require that 5-year service commitment. So my understanding is that there are some hospitals that through their HR department that have something similar, where there's a service commitment in exchange for a stipend or some funds to increase that employee's knowledge to go on to a different job position, that then they come to work for the hospital. So my understanding is that in some cases HR tracks that, and there may even already be some sort of MOU in place where the hospital has said to the employee, in exchange for this money, you will work for us for 3 years. If you leave before then there's conditions stipulated to how that repayment process would work. But yes, there would be some documentation that would be needed to ICAHN to show us how that works as far as how the hospital is
Right.
tracking it. Now, if somebody should leave and go to another rural Illinois hospital, that 5-year commitment, the rest of that could apply to that situation. But that's going to be up to either hospital or employee to the old employer and the new employer of how that may work. So some things to think about in terms of how to administer that process. Jennifer, you've got your hand up. Another comment on that?
Yeah, just Tracy, I think many of us, probably most of us, do some sort of commitment bonus now as it is. So in our own facilities, we've got that workflow settled and we're good with that. It's the hospital to hospital that really needs defined, because once an employee leaves me and they might say they're going somewhere else, I lose all contact with that employee. I won't be able to make sure that they're going to another rural facility. So it really puts me at risk. You know, I'm the one that gave the employee these dollars. I feel like I'm responsible for them. But if we aren't requiring the employee to stay at our facility, how can I continue to manage that payback or that work back period? That's concerning to me.
Sure. And I think that would be similar to if you had that payback period now for someone that would leave the facility. Just take that idea out that they're going to another rural hospital in Illinois. I would suggest that is the communication to the employee stays the same, that if they leave, however, you can inform them or let them know if they do have a job and what that may look like. I think you put it back to the employee to say, this is what you agreed to with us through this funding. If you are going to another rural hospital, then you can work that out with them, but that money is maybe owed to us, where that employee may ask the new hospital for that money and put in a similar agreement so that they can pay you back. But I think it's the same process. It just ends with you. If you have an employee that though says, well, I am going to another rural hospital, then that's going to be on them to, work through that process. So I agree with you completely that you wouldn't necessarily have that knowledge or know where you could reach them again. So it's a very similar process. It was just adding that if that should happen, that they're going to another rural hospital and can fulfill the rest of that commitment, then that would just be the next conversation that would take place. You're still obligated to us of this hospital that you're leaving. However, if you are going to another one and you can work something out with them, that's just a subsequent conversation, not necessarily that puts the burden on you. It's still back on the employee to go through that process.
Similar to that, Gloria has asked, will you all provide guidance on the payback clause if they do decide to leave their position in rural Illinois? Who would they pay the funds back to?
It's going to go back to the hospital, and then it's going to be able to come back to ICAHN. That'll be something that we'll have to monitor. So it really has.
Tracy, an idea might be to have a standardized commitment bonus or these educational assistance employee contracts that maybe ICAHN can give us a template and we all use the same one.
Of course. Yes.
Yeah.
Mm-hmm.
And Stephen asked 2 questions. One, is there an applicant match requirement? 2, can the applicant claim an indirect rate?
Are you asking from an applicant standpoint of being the hospital applying? I'm uncertain.
Yeah,
this is Stephen asking that. Stephen, if you want to come off mute. Yes, he said.
Okay. Yes. Any organization that is eligible to apply, in this case for these funds, any critical access hospital or eligible rural hospital based on their zip code, there is no matching funds. So there are no matching dollars that have to go along with this. As far as an indirect rate, not in this particular grant, wouldn't apply. The funds will be going to what you're going to have in your budget is what goes to the individuals or for the programs to develop workforce. I will defer to, I think Kathy Hull is still on here, of whether or not indirect costs can be claimed in the other ICANN administered grants. I just don't know that answer to that question.
And maybe the question too is, can you cover any employee expenses in that budget as well? I think is probably what that's being asked
Yes,
overall.
there is a category for employee expenses. If that's going to be part of your project, yes, you can build that into your budget.
And then Amy commented, but short of taking the employee to small claims court, the employee doesn't care about repaying the loan. The employee leaving really has no intention of repaying the funds. So just a comment from Amy.
Mhm. Well, that's where we're going to have some sort of agreement in place, and it may be, depending on the amount that's left, come out of a final paycheck or whatever that looks like. We hope that that doesn't happen very frequently, but understand that even today that there are similar type programs where there is a payback process and it's agreement with the hospital. So if that agreement is breached and the funds aren't there, then it's going to be up to the employer or the hospital to obviously make a decision as to how they're going to pursue that, if they are going to pursue it.
Great. And Jennifer, I think you've got your hand up again.
I do. I'm sorry for all the questions. This is my second time listening to this webinar, and
okay.
I keep thinking of things that I want to ask. So
That's fine.
So just a question, maybe you guys can answer this. So I understand that the whole theory behind this is to keep and get staff in rural Illinois hospitals. I totally get that. But has there been any kind of discussion? It seems like it would be a lot easier to administer this if the employees were made to spend their 5 years at our facility. That would provide us the stability in our workforce that we're going for, rather than some of us critical access hospitals and rural hospitals were, less than 30 miles apart. So an employee will just continue to jump to another facility like we're seeing now. So we do this all the time. We share employees because there's only a limited pool. So it's not really, while it will help, believe me, it will help. It's just not going to solve our problem with employees job hopping.
Well, I think it's like anything else. I think that they've tried to make it pretty restrictive by saying that it has to be in Illinois. They can't, go without the state. But if people have to move or their spouse moves or whatever, it's pretty limiting to say that they can't ever leave that facility. I mean, there has to be a little bit of leniency, I think, at some point. But I don't know. I think they've tried to be as restrictive as they can at this point, but it doesn't mean that won't change down the line. But
And it may be a better solution to develop a program rather than to fund individuals. Just knowing that there are options there, that it doesn't necessarily have to be funds going directly to specific individuals versus an overall program, or using the dollars for physician recruitment expenses. That already today, many of those contracts with physicians have work back agreements as part of them, years of service in exchange for some of those contract amounts and housing allowances or sign-on bonuses or whatever it would be. So just being able to look at these opportunities as different ways and be creative about how you might utilize the funds to grow your workforce.
Okay, I'm not seeing any other questions come in the chat, Liz.
okay. Well, thank you guys. We're excited about the opportunities. I know there's going to be hiccups along the way. And we hope that you grant us grace as we start this new project, and we're here to answer your questions the best we can. If we don't know the answer, we'll find out the answer, and we're all in this together. So thanks for being on today, and thanks for being excited about it too. Bye, everybody.
Thank you.
Oh.